What is gastritis? Gastritis is a condition that results from inflammation of the stomach lining, also known as the gastric mucosa, and the duodenum, which is the first part of the small intestine. It can occur suddenly as an acute gastritis, or slowly over time as in chronic gastritis. Gastritis symptoms include pain and discomfort in the upper stomach, bloating, and nausea. The most common cause of gastritis is infection with a type of bacteria called Helicobacter pylori, also called H. pylori. This bacterium can cause inflammation and ulcers in the stomach. Other causes of gastritis include using NSAIDs or non-steroidal anti-inflammatory drugs, such as ibuprofen and aspirin, and drinking alcohol. Genetics can also play a part in the development of gastritis. Gastritis may also be caused by a reaction to food, as in high acidity or spicy foods, or a parasite. What are the signs and symptoms of gastritis? It is important to note that many people with gastritis do not have any symptoms. Those individuals who do have gastric symptoms may experience the following: loss of appetite, burning or constant pain in the center of your belly, vomiting of blood, unexplained or unplanned weight loss, nausea and vomiting, bloating as in a feeling of painful tightness or fullness in the belly, black tarry stools, which is indicative of bleeding in the upper digestive tract. The severity of symptoms can vary from person to person and may come and go over time. If you are experiencing any common symptoms of gastritis, it is essential to see your doctor for diagnosis and treatment. Treatments in severe cases may also include dietary changes, medications, or surgery. Early diagnosis and treatment are vital in preventing more severe complications. Diagnosis of gastritis. Diagnosis of gastritis includes a physical exam, blood tests, and a biopsy. Your doctor will likely perform a physical exam and ask about your symptoms and history. They may also order any of the following tests to help them make a diagnosis. Complete blood count, or CBC. This is a blood test to check for anemia and antibodies that your body makes to fight an H. pylori infection. If you are bleeding in your stomach because of gastritis, you could have a reduced blood cell count, causing you to be anemic. H. pylori breath test. You will blow into a bag after swallowing a harmless radioactive liquid or capsule, and the carbon dioxide level in your exhaled breath is measured. Any H. pylori bacteria will convert the radioactive substance you swallowed into carbon dioxide. As such, any abnormal increase in carbon dioxide is indicative of an active H. pylori infection. Fecal occult blood tests, or stool tests. This checks for the presence of H. pylori bacteria in your feces. Upper endoscopy. Your gastroenterologist uses a long, flexible tube with a high-resolution camera at the end to visually inspect your upper digestive system and your stomach lining. During this procedure, you're placed under general anesthesia, and your doctor may also take a small tissue sample, also called biopsy samples, to do further tests. Your doctor may also order an upper GI X-ray. In this procedure, you'll be asked to swallow barium liquid called a barium swallow, which lights up the esophagus, stomach, and the first part of your small intestine or duodenum, making them more visible for your doctor to view on an X-ray. How is gastritis treated? If your doctor suspects you have gastritis based on your symptoms and test results, they may recommend treatment options. Treatment for gastritis depends on the cause of the inflammation and may include changes in diet, medications, or surgery. Depending on the cause of gastritis, different treatments will be recommended. For example, if gastritis is caused by an H. pylori bacterial infection, a particular series of antibiotic therapy will be prescribed by your doctor. At least 2 different antibiotics must be taken, in addition to a proton pump inhibitor or PPI, which helps the lining of your stomach heal by reducing acid that may irritate it. An infection caused by H. pylori must be eradicated as quickly as possible. And this is because this bacteria is the strongest known risk factor for gastric cancer, the second leading cause of cancer-related deaths worldwide. If the cause is unknown or non-treatable, medications may be prescribed to relieve symptoms and improve digestion. Surgery may also be recommended for some people with gastritis. Your healthcare provider may also prescribe or recommend the following treatment options. Antacids. These can be purchased over the counter, typically calcium carbonate tablets, chewable tablets, or oral liquid suspensions. H2 blockers. These medications decrease the amount of acid in your stomach. Commonly used over-the-counter medications are famotidine and cimetidine. Proton pump inhibitors, or PPIs. These are the strongest medications to reduce stomach acid because they stop acid production at the source. Examples are omeprazole and esomeprazole. Vitamin B12 if you have pernicious anemia due to gastritis. What are the complications of untreated gastritis? If you suspect you may have gastritis, you must see your medical provider to get evaluated as quickly as possible and receive the appropriate treatment. Because if it's left untreated, gastritis can lead to erosion of the stomach lining, also called erosive gastritis, peptic ulcer disease or stomach ulcers, bleeding, and anemia. Chronic gastritis can increase the risk of stomach cancer. Alright folks, hope you found this video helpful, and as always, stay healthy my friends.